The CDC report says the number of healthcare workers reporting harassment at work doubled from 2018 to 2022, and nearly half of those surveyed say they're often burned out.
Nurses have a really hard job. I don't know if the public knows that. I mean, we give our heart and soul to our patients, and like I said, a lot of times we forget to nurse ourselves, and we really, I just feel like it's a really trying time right now, and I'm kind of worried.
Nikki Avey is a Kaiser nurse and an officer in their union representing 2,800 San Diego nurses. She says the pandemic has had a lasting impact.
I've heard nurses, I've seen nurses leave the bedside or the front line in the hospitals and want to go somewhere else just because it was just too much. Their anxiety was up or their depression was really hitting them hard. And the burnout is real. It's real.
The CDC report says positive working conditions like trust in management and help from supervisors were associated with less burnout and fewer odds of poor mental health.
Wellness programs need to be distributed equitably across the power axis so that people with the least amount of power in the organization also have robust wellness programs.
Judy Davidson is a nurse scientist at UC San Diego Health. Her research has shown up to a third of employees reporting burnout may also have clinical depression.
So the take-home message there is that if you are seeing somebody who's burnt out in the workplace, you may also be seeing somebody who would benefit from mental health treatment. And left untreated, clinical depression can lead to suicide.
UCSD Health and other local systems have programs aimed at helping staff with stress or mental health concerns. Scripps Health says they have a robust in-house employee assistant program, including 24/7 peer support specialists. Sharp Healthcare rolled out a peer support model in 2021. It includes regular check-ins and referrals to other care if necessary.
Allow employees to feel seen, to feel like what's going on with them matters, and that we can work through a plan to be able to get them connected to resources.
Lindsay DeMoose runs the Stress First Aid program at Sharp Chula Vista. She's on site and available to staff who may have concerns.
We've seen that there's such a significant difference as far as how employees are receptive to that when they're in the midst of their acute stress, that they are much more apt to be able to convey what's going on for them and to be open to that immediate support.
The CDC report says the National Institute of Occupational Safety and Health has launched a campaign to help employers change working conditions aimed at improving employee mental health. Matt Hoffman, KPBS News.